Hello, this is Dr. Gulshan, consultant from 2021, and today we have Dr. Humaira Bushra, our practicing aesthetic gynecologist and sexual medicine expert in 2021. Apu, if I ask you what's the main hormones related to women's intimate health?
Well, the main driving hormone that controls female intimacy and sexual health is estrogen. It is the main hormone that basically adds to all our feminine features in a woman.
Most of the women throughout their whole life, they have heard about only one hormone, that is estrogen.
Well, the entire hormonal system, it all starts in our brain. So there is an area in our brain called the hypothalamus that sends signals to an endocrine gland in the brain called the pituitary gland. And the pituitary gland in turn now sends certain messengers, or rather hormones, to act on our main sex organs, which are the ovaries in case of females and testes in case of males. So when a girl reaches puberty at around the ages of 11 to 13 years, the ovaries start producing estrogen and the girl starts ovulating. Okay. Once ovulation has already occurred, the second half of the cycle begins and another hormone called the progesterone now takes over. Progesterone basically is the hormone that maintains the uterine epithelium and prepares the uterus for a pregnancy.
So that means with estrogen, progesterone deserves some attentions as well.
Yes, of course, because it maintains our libido, controls our mood and energy levels. And sometimes when the progesterone surge is there, lady might often feel that she is not having that much of a desire to have intimacy.
There is one hormone which is testosterone hormone. Mainly we know that it's a male hormone, but since that hormone has like some specific roles in female intimate health as well. So can you give me a breakdown about that as well?
Yes, absolutely, Sirat. In fact, when we talk about testosterone, we mostly think that it is a male hormone and it probably doesn't have any role in female sexuality. But in fact, it's the other way around. Testosterone is the main driving force in female sexuality. It is the hormone that increases female sexual desire and maintains libido in a female. It also helps in controlling the mood, energy levels, muscle strength, and sexual activity in a female. When there is an imbalance, suppose if the testosterone level is too low in a female, she may suffer from decreased libido or less desire to have sex.
Now women have to maintain both the family and the work, so stressful. They're leading a very stressful life. So can you say something about the stress hormone cortisol as well?
These days, it's very stressful for women, especially for women maintaining both families and work. So what happens is, when there is a constant stress level, the cortisol hormone, which is called the stress hormone, is raised in blood. Okay, so prolonged cortisol reduces the production of testosterone in a female body. As a result, there are symptoms like low mood, decreased libido, less urge to have intimacy, etc.
Every hormonal symptoms need hormone therapy. This is like probably one of the biggest misconception we have. Can you clear that?
It depends on a lot of factors. When a patient comes to our clinic, we first have a detailed consultation. We take a detailed, thorough history of her past medical illnesses or her symptoms, current symptoms, and then we also talk about any other medication he or she is on, or any other problems that she's facing. So after taking a detailed history, we do a thorough evaluation, including her labs, her hormone analysis and all. So whenever we feel that a patient needs an hormone analysis, then only we send the patient for her blood workups. So therefore, it is not completely true that every patient that comes to us will definitely need a hormone therapy.
So that means two individuals having the same hormonal symptoms can't have the same hormonal therapy.
Yes, absolutely. It's all about understanding how the entire hormonal system works. And that's exactly how we can come up with a treatment plan for every individual patient.
So according to our discussion today, our main philosophy about every consultation at Clinic 21 is we take the proper history, we do all the laboratory findings, we try to find the underlying causes, and then we give the safest appropriate treatment to our patients.